Good evening. My name is Dale Folwell. I'm your state treasurer. And I have a little more than 2 minutes worth of stuff here, as you can see. So maybe I'll just take my time and speak from the heart. That's typically what happens in this room, in my experience over the last several years, is not only an applicant for the job to be state treasurer, but also as the state treasurer. Let me say some things that may come across a little bit inelegant, but I believe that what you deserve is the facts. Unlike a lot of situations that you're experience or witness in public service, solving this problem is not going to make one bit of difference in my life. It's not going to change me financially or spiritually, or it's not going to change any relationship I have with my wife or family or friends. It's going to make one hell of a difference to the invisible people. The 900,000 people who are on the pension plan, the 720,000 people who are on this health plan, the people who educate our kids, protect us from criminals, pave our roads, and all the other core functions of state government. The state health plan is unsustainable and insolvent. These are not my determinations. These are determinations by Pew Research, who puts the insolvency of the state health plan right behind the state of Illinois, the same Illinois that you've been hearing about. Now, oftentimes, and you may hear this throughout the night, everybody's going to say, well, you know, you can't solve this problem overnight. But let me just tell you why we're here. We're here because over 40 years, a 40-year period of time, no money has ever been put aside for retiree health care on behalf of the state employees of North Carolina. None. And if you see me get a little more emotional about this, the reason is that one time I asked Coach K about his courtside manner, and Coach K said, you know, there's some things that happen right in front of your eyes that are worth getting upset about. We may have people in this room, I'm sure I have people at the treasurer's office, and there's people in every agency that you work for or have worked for who cannot afford to insure their families on the state health plan, which is the largest purchaser of health care and pharmaceutical benefits in the state of North Carolina. And if that's not worth getting mad about, nothing is. We have state employees, mainly young families, beginning teachers and beginning troopers, who have to make the decision between mortgage and the health plan, food and the health plan, energy and the health plan, and live their life in the state health plan. We can do better. Contrary to what you might hear over the next few minutes, this started nearly a year ago. We had a meeting with 42 stakeholders, SEANC, NCAE, legislative staff, all the insurance companies, Blue Cross Blue Shield, Hospital Association, physicians, pediatricians, mental health specialists. There was 42 people in the room, and we asked them one simple question. How much waste, fraud, and abuse do you think there is in the health system? The smallest answer we got was 12 to 15%. Now, I was very gratified to hear that, because if somebody can cut 12 to 15% out of the cost of your state health plan, we're in great shape. We can do all the things we need to do to lower the family premiums, attract younger, healthier people to the plan, to offset folks like me. So we set forth to have them give us examples of how we're really going to cut 12 to 15%. And I will tell you that if somebody says something tonight that's not true, I'm going to call them out on it. You have to own what you say in this room, and you have to be willing to stand behind it. So basically, when we got no response about how much waste, fraud, how to actually cut waste, fraud, and abuse. In the meantime, we sent a request to one hospital in North Carolina that we spend $350 million of your money with every year. Just one. And we asked for them to send us a price list, master charge list, whatever it is you want to call it, of what an appendectomy, a tonsillectomy, a knee replacement, or any of the other things that they provide. Please send us a list of what those things should cost. I know how energetic you are tonight. I'll get ready to show you something so that you can memorize it. This is what was sent to the treasurer's office about what the cost of your health care is. Every single page was redacted. Now, I'm going to close my remarks because I think I'll have an opportunity to say a few words in a moment. But I'll know this. I know many of you personally. I've gotten to know you over the last 3 years. And the ones that I know personally, Dwayne, and the ones that I don't, none of you pull one of these out of your pocket unless you know what you're getting for it. Right?
That's right.
Now, today's Senior Citizen Day at Harris Teeter, so I made a choice to be here tonight instead of saving my 5%. I say that to you in jest by telling you that imagine going to Harris Teeter and there not being any prices on the products, and then when you got to the checkout, you gave them something like this. You never got a receipt about really what you got or what you paid for, and then maybe a few weeks and months later, you get something in the mail called an explanation of benefit, which doesn't explain the benefit of anything. How many of you would do that? None of you. All of us are forced to do that with health care. All of us are forced to pull this out of their pocket, which is the state health plan card, and you never know the value of what you got, even after you consume it. The Clear Pricing Project is so simple. How many of you have heard the commercials about the risky scheme of the state treasurer? That's great, just a few. They spend a lot of money on that. So let me explain to you what the risky scheme is. It's so complicated. We're going to increase transparency. We're going to push the power out to the consumer. And the result of that is we're going to lower costs. That's the risky scheme. Let me personalize how this occurs. Before Thanksgiving, we had received an email to me from a teacher in Cumberland County. I think there's maybe one person, a couple from Cumberland County here. This school teacher was ordered to get an echocardiogram, and when they got to the imaging center to get the echocardiogram, the person said that'll be $1,200 copay and deductible and other kinds of charges. And the school teacher said, I don't have $1,200. And then they talked back and forth, and the gentleman basically said, just for my interest, if I had $1,200 to give you, can you tell me what the total cost of this would be? And the lady said, could have been a guy, but it was a lady. She said very genuinely, we would never be able to tell you that because nobody knows. Somebody stopped me coming out of my office today and was ordered to go back to a doctor to get, just to see a doctor to get something approved that the doctor had already approved because the people that are doing the imaging wanted another opinion for a procedure. This is happening all across the state. This one individual in Cumberland County took this very negative experience and 6 days later, after Thanksgiving, drove 20 miles from their home and got an echocardiogram done for $225 and never showed the insurance card. Cash. My point of telling you this is what happens when you give the power to the state employee, to the retiree, and to the consumer. When you push the power down into the hands of 700,000 people, things are going to change. Because I know how diligent you are about buying Pepsi-Colas on sale. I know how diligent you are about going to Harris Teeter on Thursdays if you're as old as I am. I know how far you will drive to save a nickel on a gallon of gasoline. Just think about taking all of that power and all that knowledge you have about how to consume in 80% of your life and applying it to this. My optimism is, as I close, is very simple. We have enough medical needs among our state employees. We have enough medical providers in this state, and sure enough, we're spending enough billions of dollars that we don't be able to figure this out. But the only way that you can figure out, and the only way you can cut costs, is to know what things cost to start with. And that's what the Clear Pricing Project is about. Thank you for your time.